Dear Mesa.
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 It's hard to express how important MESSA is to me and my family, and how
I
much
believe
we
as
appreciate
teachers,
this
we have to do whatever we can to keep MESSA.
MESSA makes it as easy as it can possibly be, and the people at MESSA really
I don't have to
care.
wonder if I can afford to take my child to the doctor. I don't have to worry about bills.
I can't imagine where we would be right now if we didn't have MESSA.
When you're young and healthy, it's easy to think nothing bad will ever happen to you.
I don't know why anyone would agree to a plan other than MESSA.
Listening to our membership, responding to their needs and concerns. That's what has made MESSA the organization it is today. Unique, member-focused, hassle-free, and always worth fighting for. MESSA.
And we talk about this at the bargaining table all the time. What if we give you health insurance that is the same as MESSA, just as good as MESSA? We're going to copy MESSA's specs and we're going to do just what they would do. It's absolutely not true. They can't do it.
I came to Michigan specifically because they had great benefits. That's why I ended up here.
I've always believed we have to do whatever we can to keep that insurance because that is our bonus in this job.
It's for all educators. It's the bus drivers, it's the custodians, it's the parapros, especially for those support staffs, because those support staffs are lucky to make a wage enough just for a living.
I carry that little card, it's like gold. And it's just a sense of peace knowing that if I need something, it's right there and it's there for my kids.
It's member-governed, member-driven. We're not a for-profit entity, so our decisions aren't based on increasing our market share or increasing our profit margin. We're always guided by the principle that led to the creation of MESSA in the first place, that being, how do you bring the best quality product to the market in terms of health care for the education employees at the best possible price?
I feel like as a local leader, MESSA is listening to what we need to have to make sure that all of our folks are getting that really great coverage.
I just really have appreciated MESSA. I've never taken them for granted, and all those years that I've had MESSA, I loved MESSA. They were so good to my family. And when we had this huge event in my husband's life, and when we really needed it, they came through. I was so grateful.
When you say to me that MESSA is not for profit, for me, it shows that you care more about people than you do about money.
This only comes to you. It only comes to you, and it's unique because it's bargained in your contract, and we care about you as school employees.
For me, the peace of mind is that I've never thought about the insurance. If I have a question, all I know is I've got an 800 number I can call. It takes about two seconds. I get the answer. I don't have to worry. I don't worry about it. I don't think about it. It's not something it's something that's only at the back of my mind. Here, you want to sit up here?
In order to be the best teacher that I can, I don't want to have to worry about my health care, my bills, my emails coming in, whatever. I just want to be able, it's a tough job. I want to be able to focus on those kids. I've only got them for a certain amount of time. I want to be able to focus on them.
I can focus on my teaching. I don't have to focus on making sure the insurance is covering my children.
I think when we're younger, sometimes we think we're going to be invincible and we don't think about those things, and we'd rather get the money instead of the health care, because we haven't been hurt, or we haven't had an incident where someone has had to spend out of pocket thousands of dollars to have a knee set or a broken arm fixed. A lot of times we don't think about those things when we're young, but as we get older and we have families, that changes.
There's a sense that being young, healthy, I remember one teacher said that in his day he would have traded his health benefits at that age for a case of beer, because you don't think about it until it happens, but it happens.
When I was single, or before my family, or even when I knew all my kids were healthy, it was like, what a waste. You look at your paycheck each month or each week, and you go, boy, I can't believe I'm taking so much out of there. But in retrospect, I look back now and say, good thing. What an idiot I was.
if you're single, you also have to make sure that you have a quality insurance, because there isn't going to be anybody there to take care of you. And so the person that takes care of you is your insurance.
Everybody loves MESSA in the school district, you know, and they're just very fortunate if they have it. If your bargaining unit ends up not being able to have MESSA, it's a blow, okay? It's a blow.
Your employees deserve the best. Your students deserve to have healthy, cared-for teachers, and don't do it because it gnaws away at everything that holds a district together. It's just the beginning. It's the first stone, and then the wall crumbles.
Why MESSA? And I'm thinking, why not MESSA? It's been there for me for 32 years. I know I don't have to worry. When I pull that card out, even if I'm elsewhere, I'm not in the state of Michigan, I know the coverage is there. I know that I'm going to be taken care of in a way that I'm happy. It's there for me, and I don't have to second guess what's going on with my health care.
Agree to something less than MESSA? Why would you want to do that? MESSA takes good care of you. That's what, it's insurance for teachers. You know, I don't have the type of job where I can take 5 minutes sitting at my desk to call my insurance rep. I cannot do that. I have children with me all the time. MESSA takes care of me in every way, shape, and form.
Members are loyal to this product because it's the kind of product they want. It's the kind of service that they want. While they're concerned about their ability to retain this coverage because of cost, we share that concern, and we continue to look for smart strategies to make sure that while we continue to keep our benefit programs of the highest quality, we do everything we can to keep them affordable.